Welcome to the Deep Dive, and today we're doing a special deep dive in our What's New in 22q series. For so many of us, supporting loved ones living with 22q11.2 Deletion Syndrome, well, it's a lifelong journey, isn't it? And while immense attention, rightly so, has focused on childhood, we're seeing more and more adults with 22q11.2 DS, and that means there's a real need, a critical need for clear, updated guidance, for their unique health and life needs as adults. So that's exactly what we're digging into today. We've got access to a really comprehensive resource, something that pulls together the absolute latest in clinical practice, specifically for adults.
Yeah, and what's really striking about this resource is the incredible collaboration behind it. It's quite something. We're looking at an updated set of guidelines titled "Updated Clinical Practice Recommendations for Managing Adults with 22q11.2 Deletion Syndrome." The lead author for this incredibly valuable work is Dr. Erik Boot, and it was published just last year in 2023. It's in that highly respected journal, Genetics in Medicine. And if we think about the bigger picture here, this isn't just, another medical paper collecting dust. It's a meticulously crafted guide, actually. It's the second version, the second iteration of its kind. And it's really designed to help make sure adults with 22q11.2DS get the best possible care, recognizing, all the ways the condition can evolve over a whole lifetime. So our mission today really is to translate this important scientific work into clear, practical insights, insights that you, as family members, as caregivers, can actually use to better support your loved ones.
Right. So what does this actually mean for you and your family day to day? This isn't just about managing specific health issues as they sort of pop up. It's really about embracing a holistic approach, person-centered care that considers the whole individual throughout their entire adult life. And just think about the scope of this thing. It involved an international panel of experts from 8 different countries. And together, they covered an amazing 24 distinct medical subspecialties. That's huge. They didn't just skim a few articles either. They did this exhaustive, systematic literature search, meticulously reviewing research published over nearly 3 decades. Think about that, from 1992 all the way up to 2021. To build these really solid recommendations, they started with over 6,000 potential papers.
Wow.
Yeah, and narrowed it down to about 2,300 relevant reports, with almost 900 of those specifically relevant to adults. But here's what really makes this stand out, something I found incredibly powerful. They didn't just rely on the scientific papers. They proactively sought out and incorporated feedback from patient advocacy organizations, representing 7,624 families from 7 countries across 3 continents. That just shows how much your experiences, your priorities, those invaluable insights from people living with and caring for individuals with 22q directly shape these guidelines, making sure they actually address real-world needs and challenges.
That's such a critical point, and it brings up an important question, doesn't it? Why call them recommendations rather than strict rules? Well, the research field for 22q, especially when we talk about adults, it's still evolving. While we've made huge progress and learned so much, there aren't always tons of those big randomized controlled trials, the gold standard studies for every single aspect of care. The authors are very open about this. They acknowledge the evidence base, particularly for adults, is still limited in some areas, and a lot of the studies fall into, let's say, lower confidence categories. So these guidelines represent the current best practices, things agreed upon by this huge group of clinicians who have extensive long-term experience. I mean, many of these experts have seen tens, even hundreds of adult patients with 22q. They have that deep practical understanding. They carefully weighed, what interventions are most beneficial and least harmful, given how complex and variable 22q is. And what's particularly fascinating here is the constant emphasis on 22q being a multisystem disorder. That means it can touch nearly every part of the body and mind, from the heart, the endocrine system, to cognition, psychiatric health, and crucially, these issues aren't static. They can pop up, stick around, or even change how they look over time, often becoming clearer or more prominent in adulthood, even if they weren't a big deal in childhood. So the recommendations provide guidance for spotting, evaluating, monitoring, and managing all these different health considerations, things that often emerge or just carry on into adulthood. And they also thoughtfully cover genetic counseling and those vital psychosocial aspects, which are just incredibly important for overall well-being and quality of life.
Okay, let's really try and unpack this with a focus on the practical side. What can people actually do? This deep dive, it's packed with valuable insights, absolutely. But we know you're looking for actionable advice, things you can use in your everyday lives to support your loved one. And the article is genuinely full of helpful do's and don'ts for families and caregivers. So let's start with some overarching principles for navigating adult care, because these really set the foundation, don't they? The first one, which I think is just absolutely fundamental, is that ongoing follow-up is key. Seriously key. Think about it this way. Whether the 22q diagnosis happened when your loved one was tiny, or even if some issues seem to, get better or resolve in childhood. Regular follow-up throughout adulthood is just essential, profoundly essential. We often focus on kids' health needs, right? But this condition is multisystemic, and lots of health conditions can emerge or just change how they present as a person gets older.
Mm.
We're talking about things that might not have been there or even hinted at in childhood, but become real concerns in adulthood.
Like endocrine issues, perhaps?
It's exactly. Or psychiatric conditions that weren't obvious before. So the recommendation from these experts is crystal clear. Prioritize periodic health assessments. Regular checkups. These aren't just about reacting when a problem pops up. They're crucial because they can catch conditions early, allowing for timely treatment and maybe even preventing more serious complications down the road. It's truly about being proactive with care, not just reactive.
Yeah, building right on that crucial point. The experts really highlight the power of having a generalist, a coordinator, essentially. Because 22q affects so many systems, individuals often end up needing to see a lot of different specialists, right? Cardiologists, endocrinologists, psychiatrists, maybe others. And navigating that whole landscape can be incredibly overwhelming for families. It really can. That's why having a family doctor, a GP, or maybe a general internal medicine provider who gets 22q, someone who understands it and who can effectively coordinate care among all those different specialists, well, that's incredibly beneficial. This person acts as the central hub, the conductor of the orchestra, making sure all the medical needs are being addressed in a joined-up way. They help prevent that fragmented care, ensuring all the different pieces of the puzzle fit together smoothly for the patient. Without that central figure, families can often feel totally lost, trying to manage complex schedules, relay messages between doctors, keep track of everything.
And that flows right into the next point, communication, which is absolutely crucial and often needs extra conscious effort because 22q affects so many systems, and individuals might have different communication styles, different cognitive abilities, getting information across to them, and just as important, getting information from them about their symptoms or feelings. Well, it can take more time, more patience.
Definitely.
The recommendation is to actively encourage healthcare providers to use clear, simple, concrete language. And don't ever hesitate to ask for things like written summaries or diagrams or visual aids to help explain important points. For instance, if a doctor is explaining a new medication, ask for a simple drawing showing where it works, or written list of instructions, clear bullet points. Repetition is also super helpful to reinforce understanding. Info might not stick the first time around.
That's right. And patients with 22q might not complain even when symptoms are quite significant, which means you often need extra effort during appointments to really uncover what's going on.
Yeah, exactly. And the article mentions a fantastic practical tool, creating a personalized medical information card. This could be simple, like a laminated card, or maybe a note on their phone, something that summarizes key diagnoses, current meds and doses, allergies, emergency contacts. Carrying this can significantly improve communication, especially with new doctors or in emergency rooms. Making sure that vital information is right there, easy to understand, it just makes getting the right care quickly so much easier.
Following right on that, the guidelines really stress the vital importance of involving family and caregivers. And this isn't just about convenience, it's about getting essential, invaluable information. It truly is. Family members, caregivers, they're often the eyes and ears on the ground, aren't they? Providing that daily monitoring of treatment adherence, overall well-being. They have such valuable insights into the individual's baseline functioning, how they normally are, and they can often spot those subtle changes that a clinician, in a quick 15-minute visit might totally miss.
Like a small change in sleep, or maybe they seem a bit more irritable.
Exactly. Or a subtle change in how they walk, something the individual themselves might not even report. So the recommendation is to make sure family and caregivers get their own dedicated time with healthcare professionals, time to discuss these concerns, these observations. It's really important not to expect the adult with 22q to accurately report everything without prompts or without that extra information from those who know them best. This collateral information, as it's sometimes called, is absolutely crucial for accurate diagnosis and effective management, especially since individuals might be reluctant or even unable to admit to or recognize their own deficits or health changes. It's really a partnership in care, isn't it? And the caregiver's input is just foundational.
Okay, here's where it gets really interesting and incredibly important for families.
Yeah.
Understanding the genetics and how that impacts family planning. The article clears up so much about this fundamental piece of 22q. First off, it states that most 22q deletions are what's called de novo, meaning they're new in that individual, not inherited from a parent. That's often a huge relief for parents who might carry some guilt, you
Oh,
know?
yeah.
However, and this is a really critical point, families need to know about 5% to 10% are inherited.
Right. That's significant.
It is. It means they come from a parent who might not even know they carry the deletion themselves because their own clinical features could be really mild or maybe atypical, almost like a silent carrier of some traits. That's a profound insight, isn't it?
It really changes things.
And the article also clearly states that affected individuals have a 50% chance of passing the deletion on with each pregnancy. It's a huge factor for anyone thinking about having kids. And importantly, the features in an affected parent don't predict the exact findings in an affected child. There's just a lot of variability. So one child might be mildly affected while another could be more severely affected, even with the exact same deletion.
Yeah, and from those crucial genetic points, several really practical takeaways emerge. Clear guidance for families. First, and maybe foremost, genetic testing should be offered to all parents of affected individuals, regardless of their age. And this isn't just about planning future kids, it can genuinely help inform the care for the whole family. I mean, imagine finding out a parent has been living with an undiagnosed deletion for years. That opens the door for their own care and support, addressing things that might have been missed for decades. Second, engaging in genetic counseling is highly recommended. It can be a truly empowering experience. And it's not just for talking about reproduction. It helps provide updated, tailored information about the natural history of 22q, adapted to the individual's current life stage, their specific situation. Genetic counselors can patiently explain all the nuances, discuss potential later onset features which can be reassuring or at least prepare families, and they can help address any associated stigma, especially around psychiatric illness, helping normalize those tough conversations about mental health.
That's so important.
It is. And third, for individuals thinking about starting a family, it's crucial to discuss reproductive options early. This could include prenatal testing during pregnancy to detect the deletion, or things like pre-implantation genetic diagnostics, often called PGD. That involves testing embryos made through IVF before they're implanted. This just allows families to make informed choices that are right for them. And of course, preconception folate supplements are recommended too, just like for all pregnancies, to support general fetal development.
So really, it's all about being proactive, isn't it? Gathering all the information, empowering everyone involved, the person with 22q, their partner, their family, empowering them to make the most informed, confident decisions for their health and their future. This is a journey of knowledge and choice.
Absolutely. And that leads us really nicely into another incredibly important area. How do we best support independence and quality of life as individuals with 22q get older? The article really emphasizes that the transition from pediatric to adult care should be timely and gradual, ideally starting way back in puberty, not just a sudden cliff edge on their 18th birthday. And this whole transition, it isn't just about medical care. It covers critical life areas like education, vocational training, finding meaningful employment, suitable housing. These are just fundamental building blocks for an adult's independence, their self-esteem, their overall well-being. It's about building a whole, fulfilling life.
Yeah, this really is about setting our loved ones up for the most fulfilling life possible, step by step, anticipating needs, planning ahead. So what are the practical takeaways here for families? First, start that transition planning early. That means talking to the pediatric care teams about adult services well before the 18th birthday comes around, making sure there's coordinated multidisciplinary care involving both pediatric and adult specialists who can smoothly hand over information and responsibilities. That helps prevent gaps in care, ensures continuity, which is vital. Second, and this is so important for a sense of purpose and routine, explore vocational training, employment, and maybe volunteer opportunities.
Meaningful activity.
It's exactly. Caregivers and agencies can really help facilitate this. The article highlights how meaningful activities boost routine, improve mental and physical health, and significantly lift self-esteem. And it's actually really inspiring. It notes that more than 60% of adults with 22q are employed, either in the open market or in assisted employment. That's a powerful testament to their capabilities when they get the right support. Third, support independent living situations, ones that prioritize community integration and functional independence, but always ensuring safety. This might mean looking into options like assisted living, group homes, supported apartments, tailoring it precisely to the individual's needs and abilities, finding that right balance between independence and necessary support. And finally, crucially, consider legal guardianship well before age 18.
Yes, this is key.
To make sure that decision-making support is in place. For medical stuff, financial things, personal matters. Taking this proactive step can give families immense peace of mind, and it protects the individual's best interests as they move into adulthood, making sure their voice is heard and their needs are met. Okay, this next section really shines a light on what can sometimes be hidden disabilities in people with 22q, especially those who might seem verbally strong or have good social skills just on the surface. The article notes that while there's a whole spectrum of intellectual abilities, the most common IQ range is borderline, typically between 70 and 85. But maybe even more importantly, regardless of their overall IQ, specific learning disabilities and cognitive impairments are very, very common.
Right. That profile is key.
Yeah. This includes significant challenges with executive functions, those mental skills that help us plan, organize, get things done. We're talking about difficulties with things like problem solving, cognitive flexibility, that's being able to shift your thinking or adapt, working memory, holding info in your mind to use it,
Right.
concentration, impulse control, stopping yourself from saying or doing something impulsive. Their thinking is often described as very literal or concrete, so they might struggle with abstract ideas, humor, sarcasm.
Things many of us take for granted.
Totally. Arithmetic can be particularly tough, and social cognition is often affected, understanding social cues, emotions, interpreting what others mean or intend. So even if they have a great vocabulary, truly understanding the nuance of a conversation or a social situation can be really hard.
And what's especially concerning is that these cognitive deficits can really contribute to poor social judgment and decision-making, which, in turn, tragically increases the risk of individuals experiencing traumatic events. And we're talking about very serious issues here. Things like financial exploitation, sexual exploitation, bullying, abuse, significant online safety worries, because they might not recognize risks or bad intentions.
That's terrifying for families.
It is. And this risk is compounded because individuals might be reluctant or even unable to admit they have these deficits or to ask for help, maybe wanting to fit in or avoid feeling different. And their adaptive functioning, those daily living skills, also varies a lot. Many adults with 22q need help with complex tasks like filling out forms, managing money, making big life or work decisions. Some might even need more basic help, like consistent reminders for personal hygiene. Plus, things like stress, poor sleep, just general fatigue, they can really negatively impact daily functioning, making even simple tasks feel much harder.
Okay, so given these complex challenges, what are the practical takeaways? How can we support this vital area and create an environment where they can truly thrive and be safe? First, regularly assess cognitive and adaptive strengths and weaknesses, especially during big transitions, like moving into adulthood. This comprehensive assessment isn't just about finding problems. It's often essential to provide that objective evidence of need, which helps secure necessary supports and services like accommodations at college or work. It also helps prevent us from overestimating their abilities, which can lead to frustration for everyone if expectations are just unrealistic.
That's a really important point, setting realistic expectations.
Absolutely. Second, counsel caregivers and professionals about those realistic expectations, about the capabilities and those hidden disabilities. Understanding that an IQ test isn't static, it's not the whole picture. That can significantly reduce stress for everyone. For instance, if someone struggles with abstract reasoning, expecting them to manage complex financial planning on their own just isn't fair or realistic. Third, implement structure and consistent daily routines. These provide a vital sense of stability and predictability. It facilitates better functioning overall, reduces anxiety, makes daily life more manageable. Fourth, use their strengths. If visual memory is better than verbal, use visual aids. Diagrams, written notes for instructions. Adapt daily tasks to leverage the skills they do have. For communication, instead of just asking, do you get it, ask them to explain it back to you in their own words.
Yeah, check for understanding.
Exactly. Or use written notes, texts, to ensure understanding and help them remember key information. And finally, if the individual is employed, consider part-time work or workplace accommodations. Things like more breaks, shorter hours, or providing repeated step-by-step instructions. It's all about creating an environment where they can truly thrive and be safe, understanding their unique processing styles, supporting them where they need it most, rather than expecting them to fit perfectly into a neurotypical world.
Now, what's truly fascinating, and often the biggest worry for families, maybe because of perceived burden or stigma, is that psychiatric conditions are the most common group of later onset issues in adults with 22q. But crucially, and this is a point the article emphasizes, with real hope these conditions are treatable, that's a powerful message. Don't lose hope.
That is hopeful.
Yeah. The data shows anxiety disorders are very common. Prevalence is about 2 to 3 times higher than in the general population. This might look like generalized anxiety, social anxiety, maybe panic attacks. Psychotic disorders like schizophrenia are also significantly more common. Around 1 in 4 or 5 adults with 22q might develop one. That's a statistic that definitely gets your attention.
It does.
Importantly, worsening emotional outbursts, increased irritability, unexplained temper changes. These are often early signs, sometimes quite subtle, of untreated anxiety or maybe a developing psychotic illness. And because individuals might need extra time, extra comfort to really articulate their symptoms, maybe due to learning difficulties, that collateral information from caregivers, the people who know them best, see them daily, understand their baseline, that becomes absolutely invaluable for getting an accurate diagnosis. They're often the first line of defense in noticing these shifts.
Right. And this isn't about blaming anyone or creating fear. It's about identifying and treating conditions that significantly impact quality of life, just like you would any other medical issue. So the practical takeaways here seem clear and actionable. First, be vigilant. Watch for changes in emotions, thinking patterns, sleep, behavior, overall daily functioning. Early detection and getting treatment started promptly are absolutely key for effective management. It can dramatically improve outcomes and quality of life. Second, the article confirms that standard psychiatric treatments work, including medications like antipsychotics or anti-anxiety drugs. They have proven efficacy in people with 22q.
Yes, that's important to know.
Yeah. And when medication is being considered, that start low, go slow approach to dosing is often best, letting the system adjust gradually, minimizing side effects. Third, if a specific medication like clozapine is prescribed for schizophrenia, it's vital to discuss with the doctor about possibly using an anticonvulsant alongside it. That's a med given with another one to help prevent seizures, right? To manage that increased seizure risk that comes with 22q.
Correct. And don't ignore managing potential side effects like metabolic changes or movement issues. Those need careful monitoring too.
Good point. And finally, maybe most importantly, don't let fear or stigma stop treatment. The article stresses that non-drug treatments like cognitive behavioral therapy, CBT, can also be really helpful, and they can be adapted to individual needs. The ultimate goal is always improving quality of life, improving daily functioning, allowing them to lead a more stable and fulfilling life. Okay, so beyond the cognitive and psychiatric aspects, the body itself needs close, ongoing attention. And this article really breaks down what to watch for system by system. It gives us a kind of roadmap for truly attentive care.
Exactly. Which brings us to that vital question. What are the key physical areas that need proactive monitoring in adulthood for folks with 22q? And what are the most practical strategies for actually addressing them? It's all about being prepared, taking action, not just waiting for problems to show up.
Let's dive into those specifics then, starting with endocrinology and metabolism. This is a major area of multimorbidity, multiple conditions for adults with 22q. Hypocalcemia, low calcium, it's extremely common. And what's crucial to get is that it can appear or reappear at any age, even if it seemed fine in childhood.
Right. It's not just a childhood issue.
Not at all. It's especially likely to flare up during times of biological stress, think surgery, childbirth, infections, even a broken bone. It might be asymptomatic, no obvious signs, or it could cause vague things like fatigue, irritability, maybe abnormal movements. In severe cases, serious heart rhythm problems or seizures. The article also highlights something interesting but critical. It can be worsened by things like alcohol or colas. Yeah, it's not just a random fact. It points to that underlying metabolic sensitivity in 22q. A reminder that even seemingly small dietary choices can have an impact.
Okay, so given that, the recommendation is pretty clear and proactive. Daily vitamin D supplementation is recommended for all adults with 22q, and calcium supplements might be needed too, especially if levels are low. You should have blood levels of calcium, parathyroid hormone, magnesium, and thyroid hormone checked regularly, periodically. And during those vulnerable times, surgery, pregnancy, acute illness, calcium levels need very close monitoring, sometimes multiple times a day. The experts strongly advise, don't assume endocrine functions are normal just because someone isn't complaining. Proactive screening is essential because these issues can be silent until they're severe.
Right. Sticking with endocrinology, thyroid disease is also remarkably common. Nearly 1 in 4 adults with 22q need treatment for hypothyroidism and underactive thyroid. And what's more, it often starts earlier than in the general population. So the recommendation here is straightforward, preventative. Thyroid function should be checked annually with a simple blood test. Also, there's that increased risk of obesity and type 2 diabetes. The article notes that even after you account for other common risk factors, the 22q deletion itself seems to add risk for type 2 diabetes, often starting on average 18 years younger than expected in the general population. That's significant.
Wow, 18 years younger.
Yeah. So the practical takeaway is implement dietary and exercise preventive measures as early as possible. Emphasize healthy eating, regular activity right from a young age to try and mitigate those risks.
Okay, moving on to neurology. Seizures are a big concern here, needing vigilant attention. Adults with 22q have about a four-fold increased risk of epilepsy, that disorder causing recurrent seizures. These seizures can be different types, and sometimes they're secondary to other things like low calcium or even certain meds. There's also an increased risk of movement disorders, including early onset Parkinson's disease, which the article notes is clinically very similar to typical Parkinson's, but it just happens much earlier in life.
Well, must be tough.
Yeah. So the recommendation is crucial. Discuss any seizure-like episodes or changes in movement with a healthcare provider immediately. Diagnostic tools like clinical rating scales, video recordings if possible, and/or an EEG, that brain activity test, can help diagnose things. For suspected Parkinsonism, a specialized brain scan might help tell it apart from, say, drug-induced movement issues. Early, accurate diagnosis is just key for managing it effectively.
Okay, cardiovascular and respiratory health. If there's a history of congenital heart disease, CHD, a heart condition from birth, regular follow-up at an adult CHD center is critical, absolutely critical. These are specialized centers set up for adults who've had heart conditions since they were kids. But even for people without a known CHD history, adults with 22q still need periodic cardiovascular checks, looking for things like aortic root dilation, where that main artery widens, high blood pressure, managing risks like obesity and diabetes.
So even if the heart seemed okay before.
Exactly. Keep checking. Asthma and obstructive sleep apnea, OSA, are also common respiratory issues. So the recommendation? Ensure regular cardiovascular checkups, even if childhood checks were clear. And if there are symptoms of OSA, loud snoring, gasping during sleep, being excessively sleepy during the day, definitely consider a formal sleep study, a polysomnography. Undiagnosed OSA really impacts health and daily life.
And that leads right into sleep itself. Often overlooked, but it hugely impacts quality of life. Insomnia, disrupted sleep patterns. They're common burdens for people with 22q, leading to fatigue, cognitive problems, mood issues. These sleep problems can stem from lots of things: underlying psychiatric issues, undiagnosed OSA, restless legs, stress, even too much caffeine. So the practical advice is discuss sleep patterns openly with healthcare providers. Don't just dismiss it. Emphasize good sleep hygiene, consistent bedtime wake-up, dark, quiet room, avoiding screens before bed, the usual advice. And critically, treating underlying conditions like anxiety or OSA often significantly improves sleep. Getting sleep right can have a positive ripple effect on so many other health areas.
Then there's gastroenterology, the digestive system. Common issues include chronic constipation, difficulty swallowing dysphagia, easy gagging or vomiting, and reflux, GERD. There's also a smaller group who get gallstones or fatty liver. So the recommendation: maintain vigilance for constipation. Dietary interventions first, more fiber, more fluids.
The basic.
The basics, yeah. If meds, like maybe clozapine, are contributing, a doctor might suggest prophylactic laxatives. Consulting a pharmacist could help find different medication forms if swallowing pills is tough. And gallstones or fatty liver might be picked up on routine scans if there's a reason to look.
For genitourinary and gynecology, while birth defects might have been found earlier, secondary problems can pop up in adulthood. For instance, people on calcium supplements for hypocalcemia have a higher risk of kidney calcification, so monitoring kidney health is important. Gynecological issues might include menstrual disorders. Importantly, the article highlights that intimate relationships, sexual activity, thinking about pregnancy, these are important for many people with 22q. But they might have limited knowledge about sexual health, contraception, or those genetic risks we talked about.
The 50% risk.
Exactly. And this lack of knowledge or clear communication can sadly lead to increased risks for unplanned pregnancies or STIs, which might also, unfortunately, be linked to exploitation. So routine assessments are crucial to identify needs and concerns, including contraception counseling, STI prevention, and regular cervical cancer screening, just like for any woman. And those preconception folate supplements and genetic counseling are standard recommendations for anyone considering having children.
What about general surgery? The article says individuals with 22q have a higher risk of surgical complications. Things like bleeding issues, infections, seizures, especially linked to calcium changes, and maybe difficult intubation, meaning it could be harder to put in a breathing tube for anesthesia.
Okay, so things surgeons need to know beforehand.
Definitely. The recommendation is to carefully manage any surgical procedures with close attention to all the coexisting conditions. Monitoring blood counts and calcium levels around surgery is absolutely essential. And clinicians need to be aware that anatomical differences, like in the airway structure, can make intubation trickier, might need special equipment or techniques. It's all about being prepared for potential complexities.
Okay, the skeletal system. Issues like scoliosis, that spine curvature, patellar dislocation, where the kneecap pops out, and various types of arthritis or general musculoskeletal pain are common. Routine physical exams for scoliosis and joint problems are recommended. Standard management applies, just like for anyone else with these issues. For immunology, autoimmune diseases where the body attacks itself and allergies are important to watch for. While frequent infections might be less of an issue in adults compared to childhood, some immune weakness can persist. So, being vigilant for and managing autoimmune diseases, including that routine thyroid screening, is needed. And critically, patients benefit from making sure all standard vaccinations are up to date.
In hematology and oncology, blood and cancer. Lower platelet counts are common, usually mild though. The article notes there may be an increased risk of cancer. Let's go into huge detail on specific types, but the main takeaway is clinicians should be vigilant for malignancy and make sure routine preventive measures like cancer screenings are done, just like for the general population.
What about sensory deficits? Hearing loss, especially high-frequency loss, is common. That's trouble hearing sounds like S or F. Vision issues like needing glasses or contacts are also common. Another important one, olfactory deficits, a reduced sense of smell. This can really impact safety, not detecting smoke, gas leaks, spoiled food, and it can diminish enjoyment of food too.
I hadn't thought about the safety aspect of smell.
It's significant, so the recommendation is to have a low threshold for formal hearing and vision testing, meaning don't wait for a big problem, test routinely. These senses are just vital for social interaction, communication, learning, overall safety. Regular earwax removal, hearing aids, glasses, often very beneficial, can dramatically improve quality of life.
And finally, dental health, an area that sometimes gets missed in the bigger medical picture. Enamel defects, reduced saliva, dental anxiety, frequent cavities, all common issues in people with 22q. This impacts quality of life, obviously, and importantly carries that risk of infective endocarditis, the heart infection for those with major congenital heart disease.
Ah, right, the heart link again.
Yeah. So the practical advice is clear. Encourage regular dental care, meticulous oral hygiene, consistent fluoride use.
Right.
And standard antibiotic prophylaxis guidelines apply for those with major CHD before dental work to prevent that endocarditis risk.
Yeah.
Wow.
Okay, that's a lot.
It really shows how attentive and coordinated care needs to be, doesn't it, across so many different areas, always adapting to the individual's unique needs, which change throughout their adult life. That's a real testament to the complexity of 22q, but also, I think, to the power of proactive, informed care.
Absolutely. And if we connect this back to the bigger picture, this review just powerfully highlights that the care journey for people with 22q is incredibly complex, and it continuously evolves through life. It's not just about tackling isolated symptoms as they pop up. It's about seeing the whole person, anticipating potential issues proactively. This proactive multi-system approach is just crucial to optimize lifetime health and functioning, moving beyond just reactive, demand-driven care that can leave gaps. And this raises an important question for all of us, really. How can we keep learning and improving? The authors really emphasize an urgent need for more research, especially involving older patients looking at long-term outcomes. Because most current reports involve adults who are, on average, only in their mid-30s, we need to know more about later life. This future research will ideally involve patients and families directly, increasing knowledge, raising awareness among healthcare providers, leading, hopefully, to even better comprehensive care, and maybe even systematic treatment trials for both drug and non-drug interventions. It's definitely an ongoing journey of discovery.
So the conversation about 22q11.2 deletion syndrome is clearly ongoing, and your role as family members as caregivers remains absolutely vital in shaping its future. This deep dive today is just one step on that journey of shared knowledge and support, highlighting that while so much has been achieved in understanding and caring for individuals with 22q, there's always more to learn, more to discover, to ensure they lead the best possible, most fulfilling lives. Thank you for listening to What's New in 22q, produced by 22q in Europe, the European Association supporting families living with 22q11 deletion syndrome. Take care, and talk to you soon.